Hi, my name is Miles Atkins, and today I'll be talking about epilepsy and the effect exercise has on seizure frequency. To most people, epilepsy is the disease where flashing lights cause individuals to move uncontrollably and white foam starts to emerge from the mouth. Although this is a characteristic of epilepsy, the disease is much more complicated and intricate, and there are quite a few types. I hope after today you all have a firm grasp on the disease of epilepsy and understand the ins and outs of the effects of exercise. So to start off, I think it is important to define what is epilepsy, and the best way to describe epilepsy in my mind is to compare it to something we all come in contact with on a regular basis, a highway. Imagine your brain is a highway with many roads and loops that are interconnected with one another. Your neurons and electrical signals that move along these roads are like cars, moving so fast that sometimes they are gone before you even realize it. Epilepsy is that annoying, nagging roadblock that causes a halt in the road, which leads to the formation of traffic, which in turn slows down the progression of your neurons, i.e., the cars in this situation. From a scientific standpoint, epilepsy is defined as when the normal neuronal activity in the brain becomes disturbed, causing strange sensations, convulsions, muscle spasms, and a loss of consciousness. All these symptoms are characteristics of seizures, and we'll learn about those a little later. Epilepsy may develop because of an abnormality in brain wiring or an imbalance of nerve signaling chemicals called neurotransmitters. Examples of these are GABA and glutamate. Epilepsy affects about 2.5 million individuals in the United States, and worldwide, epilepsy affects 70 million individuals and has come to be known as the most common serious neurological disease in the world. In fact, 1 in 26 people will be diagnosed with this disease at some point in their life, meaning someone you know has a great chance of developing epilepsy. Let's dive into some particulars about epilepsy, and we'll start with how this disease is diagnosed. There are a number of neurological tests that can be ran to diagnose epilepsy, but the most popular ones used by physicians and researchers are as follows. The first is an electroencephalography, or an EEG, which records the electrical activity of your brain. The second test is a computed tomography, or CT, which is an X-ray that shows cross-sectional images of your brain. And the third test, a magnetic resonance imaging device, or an MRI, uses powerful magnets and radio waves to create a detailed view of your brain. And finally, a PET scan, or positron emission tomography, uses a low dose of radioactive material to help to visualize active areas of the brain. If we look here in the diagram below, in the left-hand side we see a normal PET scan of a brain, and we see how the red lit up areas represent normal neuronal activity. In the right picture, we see an epileptic brain. In the bottom left-hand corner, we can see a black shadow. This black shadow represents the blockade of normal neuronal activity, therefore causing seizures. Here, I've created what I like to call the tree of epilepsy. It breaks down the disease into simple components, which make it easier to comprehend. Scientists have identified two types of epilepsy, idiopathic and symptomatic. Idiopathic refers to epilepsy due to genetic causes, while symptomatic refers to epilepsy which is caused by unknown factors. There are two different types of seizures that fall underneath this category of epilepsy, and under these subheadings are a number of seizures that are characterized by the effects they have on the body. Partial seizures are those that stem from abnormal electrical brain functions in one or more areas of one side of the brain. These are known as simple partial and complex partial seizures. Generalized seizures involve electrical imbalances in both sides of the brain, and these usually result in a loss of consciousness. Seizures that fall underneath this category are absence seizures, myoclonic seizures, clonic seizures, tonic seizures, a combination of both tonic and clonic seizures, and finally, atonic seizures. Historically, anti-epileptic drugs, or AEDs, have been used by epileptics to help regulate seizure frequency. AEDs do not cure epilepsy or treat the cause of epilepsy. Instead, they are taken to stop symptoms of epilepsy, seizures. However, they cannot stop a seizure once it has started. Doctors can prescribe either one or a combination of 26 AEDs to epileptics, and each AED is used to treat a different type of seizure. The efficacy of AEDs are outstanding, as they can control the symptoms of epilepsy in up to 70% of patients. How do AEDs work, you ask? AEDs work by altering and reducing the excessive electrical activity of neurons that normally causes seizures. AEDs are known to target sodium channels, calcium channels, the GABA system, and glutamate receptors. Here we can see AEDs in action. The names listed in the boxes are a list of different AEDs that epileptics use. On the left, we can see the GABA system and the drugs used to target it. And on the right, we can see a neuron with a sodium channel as well as a glutamate receptor. This visual helps to show how diverse AEDs are and the number of places they can attack. I hope at this point y'all have a pretty general idea about the types of epilepsy, categories of seizures, how the disease works and is diagnosed, and the basics of anti-epileptic drugs. AEDs are not the only form of treatment for epilepsy. Over the past few decades, research has grown in the area of exercise on seizure frequency, and the results are somewhat captivating. So the question is, can exercise help in reducing seizure frequency? I'm glad you asked. There are a number of studies that research the effects of exercise on seizure frequency, and I will highlight 3 of them in today's talk. The research surrounding epilepsy and exercise is in its infancy, and often scientists have come to different conclusions to whether or not exercise decreases the amount of seizures in epileptic individuals. However, the majority of research has pointed to the beneficial effects of exercise on seizure frequencies. Knockin et al. Conducted a study where 21 participants, 11 women and 10 men with generalized and partial epilepsy, partook in an 8-week study where they exercised 3 to 5 times a week for 45 minutes. In this study, all patients used AEDs. Overall, scientists were unable to make a clear-cut distinction about the effects of exercise on seizure frequency. However, there was a great amount of individual variation amongst the participants. We can see in this graph here that during physical activity, there was a significantly lower number of seizures reported here than during non-active activities. Participants reported 56 seizures over the 4 weeks during physical activity, which averaged out to 0.04 seizures an hour, and reported a whopping 448 during ordinary activities and rest, which comes out to 0.08 seizures an hour. What researchers have concluded from the study is that 2/3 of patients had more seizures during the 4 inactive weeks, showing that exercise had some effect on seizure frequency. Researchers attribute this decrease in seizure frequency to the change of GABA concentration induced from exercise. We talked about earlier how the GABA system serves as a target for AEDs, and changes in the pH of the system affects how seizures occur. Although the results from this experiment were not uniform across all individuals, in some patients, exercise serves as a seizure-reducing factor. This study shows the minimal effects of exercise on seizure frequency, so let's not stop there. A few years later, a study conducted by Erickson et al. Looked at physical exercise in women with intractable epilepsy. In this study, 15 women participants aged 18 to 50 participated in a 15-week exercise program consisting of warming up, ergonomics, and aerobic dancing. The subjects exercised at 70 to 80% of their maximum heart rate for 60 minutes, 2 times a week. This experiment was stunning. Although the results were not uniform, seizure frequency decreased in 75% of all subjects. The median number of seizures per week decreased from 2.9 during the baseline period to 1.7 during the exercise period. Overall, researchers found that weekly seizures decreased in 10 patients, as well as the median number of seizures per week decreased, with 95% confidence. From this study, we can see that in fact, exercise helps in the reduction of seizures in those with epilepsy. The final study I'd like to comment on before concluding was done by Gotts et al. And I think this is an interesting study because it involves the use of EEG recordings, and the scientists were able to see actual changes in the EEG after exercise training. Hyperventilation played a role in the study. Hyperventilation is defined as rapid or deep breathing. In the EEG recording, hyperventilation is marked by an increase of slow activity, otherwise stated as an increase in volume and decrease in frequency. Over the years, it has been discovered that hyperventilation in some cases is known to induce seizures, and it also produces seizure-like readings on the EEG. In this study, 30 adolescents were used, and in 13 of these cases, spike and wave seizure discharges were present and showed up in the EEG. To begin, participants would hyperventilate for 2 to 3 minutes to induce a seizure-like reading in the EEG. They would follow this with 20 to 50 knee bends, which served as exercise or physical activity. After this brief period of exercise, the participants would again begin to hyperventilate. Astonishingly, the seizure discharges that are present during rest disappeared during exercise. We can see in this example that at rest there are small bursts of activity. During hyperventilation, these bursts increase in volume and become more erratic, similar to how they would become during a seizure. We can see that after exercise, the EEG decreased in volume and frequency. The most interesting part of this example is that after the second hyperventilation period, the EEG was much less erratic than during the first hyperventilation period, signifying that exercise played a role in normalizing the EEG. Like I mentioned before, the seizure discharges that are present in 13 cases at rest disappeared during exercise. And in the majority of epileptics, exercise produces a normalization of the EEG, which continues for a couple minutes after exercise is completed. Scientists believe that exercise suppresses seizure activity and also raises the seizure threshold, as the EEG recording showed a decrease in voltage production and an increase in frequency. The results from the study show how the beneficial effects of exercise has on brain activity and how this can lead to a normalization of an EEG. Furthermore, it suggests that continued exercise is the best way to ensure the continued reduction of seizures. So what have we learned today? We've determined from these three studies that exercise acts as a seizure-reducing factor in some epileptic patients. However, exercise is not a cure, as seizures still occur once exercise is finished. Going back to our extended metaphor about highway neurology, if epilepsy is the roadblock causing traffic, what is exercise in this scenario? Exercise is the wrecking ball that breaks down the barrier causing the blockade of neuronal activity, in turn allowing for the free movement of traffic. The right amount of physical activity, supplemented with the correct dosage of an AED, could potentially knock down the roadblock for extended periods of time, making the commute of everyday life easier for epileptics globally. I hope you enjoyed today's TED Talk about seizure frequency and epilepsy. If you know someone suffering from this disease, please let them know about the potential benefits of exercise and how it could help produce a seizure-free lifestyle. Thank you.